My name is Kenneth Johnson. I live in Dearport, Texas. I've had 2 heart attacks and I had 2 bypass surgeries. I was told that I was not be eligible for another bypass. Then I was told I had blockage, and it just kind of slowed me down. I didn't have no energy to do anything. I was tired all the time. I wanted to sleep a lot. I couldn't walk from the house to the car without getting shortness of breath. Anagiona just would hurt. So it was bad.
So ECP is external counter pulsations. So we use ECP as a little short form for this therapy that we provide some of our patients. And ECP was developed several decades ago and is based on a really simple principle that the heart, when it pumps blood to most of the organs in the body, including the brain and the kidneys and the arms and legs. But when it relaxes and it's filling with blood, that's when blood supply occurs to the heart muscle itself through the coronary arteries. And what we found is if we can augment or we can increase blood supply to the heart when it's relaxed, that improves blood circulation in the heart arteries, improves what's called collateral, a small bypass formation in the heart itself. The technology is very straightforward. It involves the placement of blood pressure cuffs on the legs, on the thighs, as well as the lower part of the abdomen. And these cuffs are actually timed to the patient's electrocardiogram, so when the heart relaxes, the cuffs inflate and push blood back towards the heart, as well as the coronary arteries which supply blood to the heart.
ECP has really changed my life. Now I have energy to do things that I couldn't do or didn't want to do in the past. I'm back to playing music again, where before I didn't have the energy or desire to play. Working on my car, my 55 Chevrolet that I have, doing stuff for the wife around the house. I do that now. Before, just no energy. I couldn't because I hurt. The ECP treatment the room was very comfortable. I had my own thermostat. I could set it when I come in for the treatment. I had a TV, I had a remote control. Had the controls of the light, and after a while, sometimes you'd go to sleep during the treatment. It was very relaxing. It was very comfortable. The whole room, the whole atmosphere was very comfortable.
External counter pulsations, or ECP, is indicated for patients who have advanced coronary artery disease. Typically, these are patients who have ongoing angina or chest pain, ongoing shortness of breath, and are not being able to do their day-to-day activities because they're limited by these symptoms. These again are patients who've typically undergone multiple stents or previous bypasses or even redo bypasses and still have no options available to them where we can put in more stents and or do surgery. Unfortunately, I do see these patients a lot in the office. They've been to multiple cardiologists, they've been to multiple physicians trying to get relief from angina and chest pain, and have been told that you don't have any option left because we can't put any more stents or can't do any more bypasses. That's where external counter pulsations comes in. That's where we have the ability to give patients symptom relief. And external counter pulsations, typically we do in the office. There are 1-hour sessions. Those sessions are every day, 5 days a week for 7 weeks. So that's a total of 35 weeks of external counter pulsation sessions. It is a little demanding on a lot of patients with their time, but what I've noticed is after the first few days or the first few weeks of having ECP therapy, they feel so much better that they love it and they want to continue even beyond their stipulated 35 sessions.
According to my wife, I can take out the garbage now that before I couldn't. The honey-do list I take care of for ECP has just changed my whole life, my whole outlook on life. I don't even think about my heart problems now. Yes, I would recommend Karam Bala to my family, my friends, to anybody that wanted to change their life as much as the ECP treatment has done for me as a whole. It has changed my whole life, my whole outlook on life.